So, your dog and cat has just been diagnosed with diabetes, or you think they might have this disease and you just want to know what to look out for. Well, today I'm going to give you everything you need to know with regards to diabetes, simple and easy. Hello everyone, and welcome to Zoomies. Today we're going to be talking about a disease that is way more common, that affects both dogs and cats, and most of the time involves lifelong treatment, and that is diabetes. Now, diabetes mellitus, or just simply diabetes, is a disease where a pet's body cannot appropriately utilize or manage the insulin within the body, and therefore can't regulate their blood sugar levels. This happens because either the pancreas, which is an organ that produces many important hormones, doesn't produce enough insulin, or their body doesn't respond to the available insulin effectively. Insulin is a hormone that allows glucose, which is the body's main source of energy, to enter the cells and tissues. Without enough insulin, or with insulin resistance, glucose builds up in the bloodstream, and that leads to elevated blood sugar levels. Some key symptoms to look out for in a potential diabetic patient are the following. The most common and the most obvious signs is actually increased water intake and increased urination. This happens because excess glucose builds up in the body and it gets excreted by the kidneys into the urine, but the sugar pulls water alongside it. So a lot of water and sugar gets lost through the urine, and that mildly or slightly dehydrates the animal, making them want to drink more water. Other signs are things like increased appetite, anorexia or weight loss despite this good appetite, and then eventually small things like cataract formation or cloudy blue eyes, and even a sweet smelling breath. You can pick that up in cats quite frequently. If you notice any of these signs in your pet, it is crucial that you take your dog or your cat to the veterinarian, as early diagnosis and management is crucial for diabetes. To diagnose diabetes, your vet will probably do a few tests. The first one might be to make a small prick in the ear to take a single drop of blood, and that they put into a glucometer to measure the actual blood glucose levels. If it's elevated, very suggestive of diabetes, although there are other things that can also mimic this. They might also actually take some urine to see if there is any glucose in the urine, and especially want to check for ketones, that your dog does not go into a state of what's called diabetes ketoacidosis, which is an emergency and a complication of an undiagnosed diabetic or an undertreated diabetic. If both the blood sugar levels are high and the urine glucose is high, your vet may want to do another blood test, which is fructosamine, and fructosamine that is elevated confirms the diagnosis of diabetes in cats and dogs. It is important to stress that during the process of diagnosing, it is important that the vet do all these tests, because there are other diseases and conditions that can actually mimic very similar clinical signs as like diabetes, especially things like Cushing's or hyperadrenocorticism and renal disease in cats. Certain factors can increase your pet's risk of developing diabetes. These include genetics or breed predispositions, such as Yorkies or Burmese cats, obesity, dogs with concurrent pancreatitis, like Schnauzers, and even certain medications, especially with long-term cortisone use. Middle-aged and older pets are also more commonly affected. In cats, male dogs have a higher risk, but in dogs, females are more commonly affected. So, how does one manage diabetes in cats and dogs? There are three key things. Number one is daily insulin, most of the time twice a day, diet changes, and regular exercise. The insulin is best given twice a day, just helps for them to regulate their blood sugar levels, and this has to accompany a meal with every injection. But most of the time we actually make dietary changes as to reduce the amount of glucose a pet ingests, and rather making use of proteins and fats as food sources. Regular exercise is also important as to reduce your pet's body condition score and preventing obesity. If your pet is already in a good condition score, well, then just carry on as normal. At the clinic that I work at, we have a whole demonstration and time booked out for clients that are new to the whole diabetic situation, where we actually do a demonstration and training session with the clients on their animal to allow them to practice giving insulin to their pets, where we give all the tips and tricks. So modern medicine has actually made it easier for cats, as there are now oral medications available for cats that help them to regulate their blood sugar levels better, and most cats don't even need insulin, which most clients are very happy about. Back to the diet, an important thing to do is you want to feed regular meals of low carbohydrates, high proteins and fats, and also high fiber. These regular feedings just help them to maintain good levels of glucose throughout the day, as the insulin is available to be utilized with this. When it comes to diet changes, I advise a client to see a board-certified veterinary nutritionist to help them formulate a diet, because there is actually evidence to show that home-cooked diets are actually superior but need to be balanced, especially in older animals. Don't see a regular pet nutritionist. Please see a board-certified or accredited veterinary nutritionist to help you formulate these diets. One last thing that you need to watch out for any cat or dog with diabetes is that they are very prone to developing urinary tract infections. Because of this sugar that gets excreted in the urine, the sugar builds up in the bladder. It's the perfect environment for a bacterial organism to go into and grow and proliferate, and this can actually interfere with the treatment and management of the diabetes. Here are some tips and tricks that you can do at home to avoid unnecessary complications with the diabetes and maybe even save you a trip to the vet. You can actually monitor your pet's glucose levels at home using either a glucometer, but modern technology has made it easy with a thing called a Freestyle Libre, which is almost like an implant that measures your pet's glucose levels over 24 hours and can stay in use for up to 14 days. Very, very convenient and very accurate. We've started implementing this as well. Alongside this, please keep a diary of your pet's food intake, insulin doses, and blood glucose readings for when you do visit the vet. Like I said just now, maintaining a good feeding regime and regular exercise is crucial. And then lastly is watch your dog or your cat for complications. Signs of low blood sugar, which is a complication of diabetes, is severe lethargy, vomiting, inappetence, poor energy levels, isolation behavior, and physically looking like they want to die. This is actually an emergency, and you should get this pet to your vet as soon as possible, as this may actually progress to having seizures, going into a coma, and even death. As a tip, write this down. You can actually take any source of glucose or dextrose, honey, sugar, anything that's high in carbohydrate, and rub it on your cat or your dog's gums and on the tongue to help increase those glucose levels acutely, and it works like a charm. At the start, it may be tough to find the right insulin dosage for your pet, and your cat or dog may need to visit the vet every few weeks to perform what's called a glucose curve, where your vet will monitor if there is adequate response to the concurrent insulin dosage and adjust as needed. Managing a diabetic pet is a lifelong commitment. But with this commitment, the right care, and the correct approach, your cat or dog can lead an otherwise perfectly happy, normal life. And your vet should be there to help you every step of the way. Thank you for watching this video. If I left anything out, let me know. If you have any cool tips, tricks, or comments, leave them down below. Let's share this information with everybody. I'll be doing more of these videos, so keep an eye out for that. Until next time, cheers.